Senator from Colorado.
I'd like to welcome the presiding officer to the Senate and to say thank you very much for your willingness to sit here this evening. To my colleagues, thank you for being here. The hour is getting late, so I'm not going to take up a lot of time with my own words, but I did want to come to the floor and read the words of people that have written my office, Coloradans who took the trouble to tell me what their concerns were with this suggested repeal of the Affordable Care Act. And given the fact that they took the time to write, I wanted to have the opportunity to be here tonight to read their words into the record. It matters to a lot of people in my state because more than 600,000 people are now insured in Colorado who were not insured before the Affordable Care Act. We've had one of the largest drops of the uninsured rate in the country. We've dropped from 14% to 7%. Really importantly, from the point of view of saving money, the amount of uncompensated care has gone down by 30%. So those at the hospitals, those are statistics. But the letters tell the human dimension, the human story that so often is lost in the chambers of this Capitol. A letter from Catherine from Denver who wrote, quote, "The Affordable Care Act has been crucial to my family the last several years. My sister, a type 1 diabetic since age 10, is now a Colorado business owner. The Affordable Care Act allowed her to pursue business ownership because for the first time in her life, she could get individual health insurance coverage without being denied due to her pre-existing condition. ACA allowed her to leave her full-time job and start a part-time business and get benefits through ACA. I truly believe," Catherine wrote, "so much good has begun to come from this legislation, and repealing it will have catastrophic consequences for my family and for so many others." Terry from Denver writes, "I am writing concerning the Affordable Care Act, the ACA. In 2010, I left my conventional job and took a risk, forming a company to perform engineering consulting services. Since that time, I've helped multiple organizations improve the safety and reliability of their products and consider my efforts to be quite successful. However, I would not have taken the chance to go off on my own if it had not been for the Affordable Care Act. The ACA gave me options in health insurance that I would not have had prior to its passage. There are millions of people like me who count on the security of the ACA. These people are entrepreneurs, freelancers, the self-employed, early retirees, and the like, who would not have health insurance if not for the ACA. Therefore, I'm asking for your continued support." Catherine, a nurse from Aurora, "I want to tell you a personal story," Catherine wrote, "in the hopes that you will think about the people in your state who might be affected if the Affordable Care Act is repealed." And that is who we are here to talk about tonight. That is who we are here to think about tonight. Catherine wrote, "I have a daughter with schizophrenia. When we had to bring her home from college, we were terrified about what might happen to her and where she would find treatment. Because of the Affordable Care Act, she was able to stay on our insurance for the next 3 years, even though she was no longer a student. That's one of the most popular provisions of the Affordable Care Act. Although it was a long process," she wrote, "and not easy, we were able to help find quality mental health care providers, and her care was covered because of provisions in the law that provided for mental health coverage, provisions that the senator from Michigan I know worked on. She is now doing very well. She's married and able to work part-time and function as an active member of society. As a nurse," she writes, "I have cared for many people over the years who have had chronic conditions through no fault of their own. Before this law was passed, many would not get insurance, or if they did, the cost was beyond their reach." Nicholas from Colorado, "My wife was diagnosed with stage 4 colon cancer at the age of 38, almost 4 years ago. We've been living with it in a chronic disease, and she is in stable condition. Healthcare costs have been about $15,000 a year for us out of pocket, but we've been able to manage because of the protections afforded by the ACA, specifically no caps on annual or lifetime benefits and no denials for pre-existing conditions. Please assure me you will do all you can to keep those protections we so desperately rely on from disappearing." Sarah writes, "On June 20th, 2016, my second child, my daughter Emma, was born. She was born 6 weeks early and weighed 3 pounds 10 ounces at birth. We knew prior to her birth that she had a heart defect, a hole in her heart, that would need to be repaired through open heart surgery during the first year of her life. We also knew that she wasn't growing properly and she might have other issues. During the past 5 months, Emma has undergone more surgeries and procedures than most people will undergo in their entire lives. I haven't recently tallied the cost of Emma's medical care, but I believe, she writes, Sarah writes, but I believe she will easily reach $1 million or much more in medical expenses before she turns 1. I have become extremely anxious about how my family will meet Emma's ongoing needs if the ACA is repealed and insurance companies are allowed to reinstate lifetime maximums and to discriminate against pre-existing conditions. I beseech you to do everything you can to preserve the provisions that will help my family and to do everything possible to ensure that the millions who have finally been able to acquire health insurance since the Affordable Care Act was passed don't lose their insurance. And people have received probably hundreds of thousands of these letters in the Senate. And it seems to me, yeah, we should be having a conversation about how to make the law better. I've said from the very beginning that I don't think it's perfect. I think there are big problems with our health care system before we passed the Affordable Care Act. I think there are big health care problems with our health care system today. That's a fact that anybody in America ought to be able to notice. And the United States Senate ought to be able to notice that and say, why don't we make it better? Why don't we improve it? We should improve it. I would love to meet with colleagues here to talk about how we deal with the fact that in rural Colorado, there's not enough competition in health insurance for people. I'd love to be able to have a conversation here about how to drive the cost of insurance down in rural Colorado rather than continue to see those costs increase. And I would say this, if there's somebody here with a solution to that problem, on either side of the party, I'd be happy to write that amendment with them. But the problem I have with where we are in this debate, and I'll close with this, is that we're talking about throwing out all the protections that all of these people have come to rely upon, all of these people have come to count on in America with our health care system. We're going to throw them out, but we're not going to tell you that what we're going to put in its place. In fact, for all you know, we're not going to put anything in its place because what we've heard is that there's no consensus on the other side about how we should move forward. Part of the problem I've had with this legislation since the beginning is we've been unable to forge a bipartisan consensus on how to deal with the fact that this country is spending 16% of its GDP on health care when every other country in the industrialized country in the world is spending about half that, or in some cases less than half that, and delivering better results. I'd love to see a bipartisan consensus on that. But what we've come to understand in the days leading up to this debate is that there's not a consensus on the Republican side about how we should go forward. And after 7 or 8 years, you'd think we'd have the opportunity to see a plan. It's not hard to think about what the values would be underlying a plan. The values that would say, let's try to maximize coverage where we can. Let's try to increase quality where we can. Let's try to drive prices down where we can. Let's try to spend less as a country on health care than where we can. Those are not Democratic or Republican ideals, and it would seem to me those values would have the virtue of being able to inform Democratic pieces of legislation and Republican pieces of legislation. But in 8 years, we haven't seen a plan. So here we are tonight talking about repealing the protections that Coloradans are counting on every single day for their peace of mind and so they can plan for the sake of putting nothing in its place. It reminds me, and colleagues, I'll close with this, it reminds me of the complaints that I've had in my office and as I travel the state of Colorado where people say, Michael, we paid into our health insurance company. Month after month after month, we paid our premiums. And then when my kid got sick and I called them up, their response was to keep me on the phone as long as possible without an answer in the hope that I would give up and go home and that the claim wouldn't have to be paid. And to be honest, colleagues, I've heard that before we passed the Affordable Care Act, and I've heard that since we passed the Affordable Care Act. We have more to do. That's the honest thing to say here. But for us to talk about repealing this, taking away the benefits that people have, the protections that people have, the security and peace of mind that people have, and replacing it with the equivalent of leaving the American people on hold so they'll give up, so they'll move on to the next thing, is beneath the dignity of this place and is not worthy of the members of the United States Senate. I want to close just by saying what I've always said. I will work with anybody, Democrat or Republican, to make sure that we really do have affordable health care in this country for the American people, the people that I represent in Colorado. And I look forward to our getting to a place where that is the politics we're pursuing in this chamber instead of the politics we've seen over the past number of years. And with that, Mr. President, I yield the floor.